So let us now begin this day of scholarship and recognition with enthusiasm and anticipation for the inspiring presentations that lie ahead. So I call to the stage our first group to present. Please come up. Implementing an international service learning workshop for SUNY Downstate.
Hello, good morning, everybody. So my name is Giselle Calderon.
My name is Somaia Mahjabin.
I'm Ada Liu.
And I'm Jenna, Derleth. So as Dr. Brewington mentioned, we will be discussing the implementation of an ISL, or International Service Learning Workshop, for here at SUNY Downstate OT curriculum among us students. So what is service learning? Service learning refers to the opportunity in which institutions provide their students a chance to apply what they have learned to contexts beyond the classroom, while offering services within a community. International Service Learning has provided a structured academic experience in which students can, 1, address international community needs, learn from direct interactions and cross-cultural dialogue with others, and reflect on the experience to gain further knowledge of course context. So ISL projects have involved groups of medical volunteers in various countries around the world, including but not limited to Costa Rica, Tanzania, Colombia, the Dominican Republic, Mexico, Panama, all over. So they provide medical services for underserved communities, as I mentioned, that lack access to the adequate resources that they may need. So the field of OT has enhanced the quality of life within these communities by improving individuals' daily functioning and occupational performance through various therapeutic interventions. So in terms of the impact of ISL projects, there is a study by Lawson et al. 2017 who utilized a qualitative research design to gain an understanding of varying perspectives of OT practitioners who have participated in ISL as OT students, so while they were still in a program. So the 9 OTs participating graduated from the same OT program in the US and traveled to Guatemala for their ISL experience. Once having interviewed the therapist, there were 3 recurring themes that were found. So number 1, participants encountered many new experiences that led to a variety of newfound emotions. 2, their experiences in the Guatemalan culture provided a deeper understanding of culture. And 3, all participants had stated that their ISL experience allowed them to practice occupational therapy skills and interventions with limited resources. So just a little bit more on student development. A study conducted by Jones et al. 2015 had illustrated the impact that participation in a rural community-based ISL program had on its students. So we know that with an ever-evolving world of diversity, equity, and inclusivity, there is a pressing need for healthcare professionals to obtain culturally competent mindset, as we all know. So here it was found that ISL experiences allowed students to not only immerse themselves into a culture that differed from their own, but allowed them to develop empathy by becoming a minority in a new context. ISL projects have also improved areas of cultural competence, as I mentioned, and understanding the intercultural relations among OT students while enhancing areas of clinical reasoning, empathy, and self-confidence, all vital aspects of developing into a profound professional in the OT field.
So this leads to our research question: how can implementing an ISL workshop improve student preparedness for engagement in OT abroad trip? So amid tensions of the COVID-19 pandemic, there was a pause in the activation of ISL projects and limited research on the current state of student preparedness when participating in international projects representing a gap in literature. So the SUNY Downstate OT program also lacks an existing workshop to better prepare students who have an interest in expanding their horizons as future clinicians. Failure to design an effective workshop will result in limited exposure to foundational knowledge among students who wish to participate in ISL, subsequently being a considerable disservice to their academic and professional progress. So we use a mixed methods design study to gain a comprehensive understanding of the effectiveness of the ISL workshop for SUNY Downstate OT students who wish to take part in an ISL trip to Belize. So our target population consisted of first and second year OT students enrolled at SUNY Downstate Occupational Therapy Program, and our sample size consisted of 37 students. Our inclusionary criteria included participants who were fluent in English, had access to a computer or a smartphone for survey completion, and were current first and second year OT students enrolled in SUNY Downstate OT program. Our exclusionary criteria included individuals who did not hold OTS credentials and were under 18 years of age. So now we have the procedures for implementation of our workshop. The workshop content was designed based on an 11-question survey given to previous travelers of Therapy Adventures, a nonprofit organization that coordinates ISL projects. First and second year OT students were recruited with flyers posted around the OT floor and sent to their Downstate emails. Participants completed the pre-workshop survey electronically on the day of the workshop, and after completing the pre-workshop survey, they engaged in the workshop for 1 hour. Discussions were facilitated to address any questions from participants during the workshop, and following that, the post-workshop surveys were taken electronically. Now in terms of the procedures for data collection and analysis, pre- and post-workshop surveys were administered through the Qualtrics platform. Qualitative and quantitative data were gathered on students' knowledge, skills, and confidence levels in certain areas such as cultural competence, clinical reasoning skills, empathy, and self-confidence. Analyses were conducted to compare the pre- and post-workshop data and determine the significance of any observed changes. Quantitative responses gathered from Likert scale items in the pre-survey were analyzed to gather conclusions. Qualitative responses from the post-workshop survey, which contained open-ended questions, were transcribed using the Atlas software to recognize common themes.
So here's a glimpse of our flyer that we use to promote our research study and our QR code for our workshop presentation, which you can also find in the poster board outside. Here are some sample questions from our pre- and post-workshop survey. We can also find the QR code in the poster board outside. And here are our facilitators from the workshop, and here are our participants from our workshop as well. So for our results, specifically pre-workshop findings, when it came to previous knowledge of what ISL is in the context of occupational therapy, 51% stated they were not familiar at all, while 31% stated they were slightly familiar. When it came to the correlation between engaging in an ISL trip and future professional growth as an OT, 57% strongly agreed that engaging in an OT trip abroad would align with their career goals and aspirations. 73% also strongly agreed that an ISL trip would significantly impact their cultural competency and bedside manners. Meanwhile, 70% strongly agreed that they expected the workshop to increase their empathy towards individuals from different cultural backgrounds. When it came to preparedness for participating in an ISL trip, 35% felt they were not prepared at all, while 24% felt slightly prepared. Nonetheless, 49% indicated they were extremely likely to actively seek opportunities for intercultural learning and engagement in their future practices as OTs. When it comes to previous knowledge of Belize and other cultures, 43% strongly disagreed, and 27% somewhat disagreed about having previous level of knowledge of the host country's culture. Despite this, 57% expressed feeling somewhat comfortable with interacting with individuals from diverse cultural backgrounds. For our post-workshop findings, 4 common themes were identified among participants: cultural awareness, cultural competence, learning, and healthcare decisions. For our first theme, a strong emphasis on cultural awareness among more than half of the participants were found. This suggests that the workshop was effective in helping participants appreciate the differences in cultural practices and beliefs they may encounter during the ISL trip. When it came to cultural competence, terms such as appreciation and respect were frequently mentioned, indicating that students value cultural differences. This is essential for providing holistic and effective care to individuals from diverse backgrounds. Our third theme of learning showed findings of improved knowledge and education, supporting the workshop's overall effectiveness. Participants expressed an increased sense of readiness to engage in an ISL experience with elements of personal growth and professional growth. Lastly, healthcare decisions were found important as they related to the course of treatment, which is important to consider. And lastly, participants expressed a need to respect others and establish positive relationships in order to provide quality care when abroad.
These are two tables that we formulated based on the comparable results that we got from the pre and post workshop surveys. So the first table is demonstrating how prepared do you feel for participating in an ISL trip. And the table 2 is I am knowledgeable about the host country's culture. This is also displayed on our poster board outside as well. So the impact of our workshop. We saw that it enhanced participants' understanding of the host country's culture and their ability to provide culturally sensitive care to diverse populations. This is essential for OT students interacting with different cultural backgrounds as it allows them to provide more comprehensive and effective care. It also helps students develop skills related to communication and empathy, which are essential for creating positive therapeutic relationships with clients and establishing rapport. So we have some limitations, one of them being generalizability. So the workshop was implemented at a single institution, Downstate, which may limit its applicability to other OT programs. Future research could benefit from a larger sample size and inclusion of multiple institutions to improve the workshop's effectiveness and generalizability of the findings. The second limitation was the discrepancy in post-workshop data. There was also discrepancy when we were seeing the completion of the surveys. The pre-workshop survey consisted of 37 participants, and the post-workshop survey was 36 participants. So for the conclusion and further directions of where we want to take this and possibly other groups taking on this challenge next year, after the workshop, there was a supplemental improvement in participants' feelings of preparedness for ISL. There was a greater understanding of the host country and increased willingness to engage in ISL. Participants also reported increased knowledge in delivering culturally sensitive and competent care. It also contributed to better health outcomes for patients. Despite the posed limitations, the results indicate that workshops' role in promoting the personal and professional development of OT students. As the OT field aims to meet international healthcare needs, it is necessary to incorporate ISL projects with preparatory measures into the curriculum of OT programs. These are references. Any questions? Okay. We just want to thank Dr. Krystal Brewington for her unwavering support throughout this whole process and guidance, and also the staff of Therapy Adventures and the previous attendees for their feedback that strengthened the workshop effectiveness. We also want to thank the first and second year students of SUNY Downstate's Occupational Therapy Program and the IRB for their approval. Thank you, everybody.